Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Marketing Director for Central Care. And with me today is Radiation Oncologist and President of Central Care, Dr. Perez-Tamayo. At Central Care Cancer Center, we are dedicated to keeping expert cancer care close to home. We have state-of-the-art facilities throughout rural Kansas and in Missouri. Whether you need radiation or chemotherapy, a second opinion, maybe access to clinical trials and novel treatments, financial counseling, or other supportive services for yourself or your family, even genetic screenings for cancers, Central Care is here for you. At any time, feel free to email with any questions or comments to askdoctor@cccancer.com. That's askdoctor@cccancer.com. Today we're going to highlight stomach or gastric, pancreatic, and esophageal cancers. Good morning, Dr. Perez-Tamayo.
Good morning.
First off, I thought maybe let's just talk about the location of all these cancers, and why not explain how they all kind of relate to one another?
Well, all of them are part of the gastrointestinal or basically how you absorb food and pass through the gut system. So they all are really interlaced, starting with the esophagus, which starts at the level of your vocal cords, behind your vocal cords, in fact, and then it goes down. So there's three segments to the esophagus: the neck esophagus, the thoracic esophagus, and then the abdominal esophagus. And then it goes into the stomach, which is really the first major organ of the gastrointestinal tract in the abdomen, going into the duodenum. Duo means two, the second part of the, and that's where the pancreas is connected.
Does it take a while when it comes to stomach or gastric cancer? Does it take a while for cancer of the stomach to develop?
Well, cancer of the stomach is not as common in the United States as in other places. In fact, about 22,000 new cases are in the United States, but it's more common in Eastern Asia, Japan, China, Korea, thought to be due to smoked food. In other words, smoked fish and smoked, there's a lot of smoked different things. And it supposedly, and this is not yet, confirmed 100%, but it is the hypothesis that anything that you eat, like those burnt ends that are delicious, well, those give you a carcinogen load. So if you're doing this every day, like some of the countries that eat smoked fish every day, then you're adding this load of carcinogens every day to your stomach.
I was just going to say, don't tell me I can't have my smoked brisket and then every once in a while, right?
Once in a while is good. It's the problem of having it every day. And everything that is barbecued and crispy is always excellent. However, it has that problem. Then there's other risk factors as well. There are certain hereditary problems that can lead to gastric cancer. It is so common in this country that just like we would do screening for cervical cancer here in the United States, they have a screening for a gastric cancer.
What does that entail?
Well, in the most simplistic ways is you swallow a little piece of stone with a string and they bring up tissue from your stomach.
Way.
Yes, it's like a pap smear, but only it is of your stomach.
I'm envisioning this, and it doesn't sound pleasant.
No, it isn't.
So what would the symptoms be for stomach cancer? I guess weight loss, maybe?
Well, unfortunately, they are not. It is a silent cancer because the stomach is, and depending on the size of your stomach, it can grow quite a bit before it starts giving you symptoms. But early satiety, which means that you basically feel full faster, is a symptom. Why? Because you have something that is taking up space, but not only taking up space, but also the flexibility of the stomach being like a balloon cannot expand as it normally would. It would be like putting a girdle to your stomach, and therefore it can't expand, and then you feel full. Other symptoms can include blood actually in the stool that is black, because what is happening is the bright red blood that is being given by the cancer in the stomach is digested, and it turns into a dark, tarry type of bowel movement. And so you have to go to the doctor if you see that symptom. Then it could be also pain, actually like an ulcer. An ulcer that is not malignant can give you pain. It feels like, like a reflux, and that can also be a symptom. Or also hematemesis, which means that you're actually throwing up blood that is bright red, can be a symptom of something in the stomach, in the proximal portion of the stomach.
So mainly, is this going to be like an older generation type of cancer if it does occur here in the United States? I mean, those slight cases?
Yes, it is. Actually, you see it more in an older population, and but there's more tendency in certain populations and certain people that eat risky food. But yes, it is actually more common in men than in women. And it is of an older age group.
And it easily could spread, correct? Maybe to the pancreas, right?
Unfortunately, so if you consider the stomach like a bean, the part of the bean that's where it has like the indentation is called the lesser curvature, because it is that way. It's just a smaller curvature, and the broad part of the bean is the greater curvature. The greater curvature is actually near your spleen. The lesser curvature is near the middle of you, and there's a lot of lymphatics that go into that area and blood. So that's why if you get stabbed in the stomach, you usually don't make it because you bleed to death. And that's one of the problems with the stomach cancers, is that they go early into the bloodstream or into the lymphatic system, and then it's hard to control them because they are already far along in their trajectory. So most of them are diagnosed higher in their stage. And in addition, there are some cancers of the stomach which are very, very malignant, and they quickly start forming seeds that seed your coelomic cavity, or the cavity where your guts are, your stomach is, and starts just basically pouring this seeds of cancers throughout the abdomen. And you begin, one of your symptoms would be that you, for reasons that are not due to gain of weight, you start losing basically your waist. You start having increased girth because of this seeds that are being projected from the stomach.
What is the treatment necessarily for?
Well, when you have it early enough, then you can have different treatment options. The treatment options usually have to do with surgery and preoperative treatment. Preoperative treatment, meaning before surgery, can be both chemotherapy, or it can be chemotherapy and radiation. And depending on where you are seeing, that you may see a prevalence for one or another type of approach preoperatively. In MD Anderson, you see more of a combined chemoradiation approach preoperatively, meaning before surgery, for cancers that are known to have lymph node involvement, or they're a little bit bigger T2 cancers. If you have a small cancer that just happens to be in a location where it causes irritation and pain, and you just happen to pick it up early, then usually a gastrectomy or removal of your stomach is usually the only thing you need if you don't have any lymph nodes or any spread.
Again, I'm with radiation oncologist and president of Central Care Cancer Center, Dr. Perez-Tamayo, and we've been talking about gastric cancer, but now let's jump into pancreatic cancers. Doctor, as far as pancreatic cancer, where does it necessarily sit within the body, and what is its function?
Well, the pancreas is an extremely important part of our digestive tract. It is hinged upon the duodenum, or the duo, the second part of the stomach. And it is actually, the duodenum is composed of several parts, and it looks like a C in cat. And the head of the pancreas, which is the most important part of the pancreas, sits right where the C is, and the tail goes towards your left, towards the stomach area. And it is what produces your digestive juices that, like for instance, everybody knows insulin is produced in the pancreas, and other important digestive juices that help us break down food so that we can actually assimilate them. People sometimes have this idea that sugar feeds cancer, but actually the reality is the only building block that we understand as food is glucose, which is a sugar. So this is the function of the pancreas is the first step into converting food into the fuel that we need. It's for instance, if I was to tell you that your car needs, gasoline, but it comes out of raw petroleum or diesel. You couldn't put diesel in a gasoline car. You would wreck your car. So it has to be in the right format, and that's what the pancreas starts doing. So that's what, that's the main function.
So essentially you couldn't necessarily live without the pancreas.
You can live without the pancreas, but then you need to have something that will help you in this process of digesting and breaking down things. So yes, in fact, the treatment of cancer of the pancreas primarily evolves around surgery. Surgery, if you can have surgery for cancer of the pancreas, it's always a good thing. And surgery usually requires a complete pancreatectomy or a Whipple procedure. The Whipple procedure actually is much more than just a pancreas, because this organ is so intimately involved in the center of your body, involving the duodenum and parts of your stomach and parts of your spleen, that it may require, a very much larger surgery than you envisioned because of maybe the projections that this cancer has upon these organs. But making it resectable is the whole goal of treatment. So if we can go to a non-resectable cancer because it's involving the duodenum or the vessels or the nerves, and we can make it resectable because we're able to basically dry up the projections of this cancer onto other organs or lymph nodes, and making it resectable, then it's when we begin to have a possible cure.
Let's talk about survival rate for pancreatic cancer. I mean, stage 1 versus stage 3.
Well, most cancers are not stage 1. In fact, the overall 5-year survival overall is 8%. And it's very, very limited because there is a very quick evolution of this cancer into an unresectable situation. A stage 1 cancer is a cancer that is less than 2 centimeters or less than an inch without lymph nodes. That's almost unheard of because you don't have symptoms. Then any cancer that has lymph nodes, right there and there, you already are going to have a stage 2 to 3 cancer right away. And what the nodes are, if you have 1 or 2 regional nodes, meaning the nodes around the pancreas, versus the nodes that are a little bit further away, like in the celiac axis or the porta hepatis, then you're beginning to have an unresectable, incurable tumor, which is the majority. So, and these are, usually seen in males more than females, but it's about the same. The typical diagnosis is actually earlier. It's around age 50 to about 70. And it is more common in the developed nations rather than the more, basic nations. And why, we don't know. Are we stressing our pancreas? There's really the risk factors are some associated with some of the mutations, like the ATM mutation is one of them. And the P16 and BRCA cases are also higher risk. And they say, and this is not confirmed, but if you have a problem with alcohol or chronic pancreatitis, diabetes, and even tobacco use, it is somehow more prominent in people with pancreatic cancer. But none of them are really reciprocal. It's mostly the genetic ones that are very seldom, and these are the ones that that are really in the high-risk groups where people are being followed at the university level. Most people are, because it is the way it is, and when people start turning yellow, which is usually the number one symptom,
Jaundice,
they turn yellow because the blockage of the pancreatic head receives the gallbladder juices, which help break down fats. And so if this mass is producing a dent or a crimp on this pancreatic, this duct, the gallbladder duct, then basically you can't let these juices come in, and you become jaundice. You have this yellow tinge. Your bilirubin goes up, and it could be like from one day you're fine and the next you're not. Where you first see it is actually in your eyes. The sclera of your eyes, around your, the iris is your colored part of your eyes, and you begin to see that the whites of your eyes are really yellow. Many people don't really see their skin as being yellow because of the way the light hits it in a light bulb, but If your eyeballs become yellow, that's a sign that something isn't right.
So there could be a genetic component as well with pancreatic cancer if it runs, I guess, in the family of some sort.
Yes, there's some association, yes.
And then as far as a screening test, I mean, how do you even just go about, I just feel jaundice, to even be tested whether or not to see if...
Well, sometimes you can pick it up in your blood work because you begin to see your liver functions are not working.
Okay.
Perhaps you're not jaundice, but you begin to have your liver start suffering, not because it's being invaded by the cancer, but because you're not draining your bile salts. But pain can be another symptom because it's by the celiac axis. The celiac axis is basically the first step in your aorta as it goes down and feeds your organs. And this celiac axis in the boxing world is called the breadbasket or the solar plexus, and it has a lot of nerves, and it can be invaded by this cancer. You can have pain.
So it feels like you have a gut ache.
Or nausea. Yes,
Yeah.
gut ache. Mm-hmm.
Wow. So, of course, we've seen pancreatic cancer a lot in the news. The death of Jeopardy TV show host Alex Trebek. He passed away November 8th of last year at age 80, and he battled stage 4 pancreatic cancer for over a year. Supreme Court Justice Ruth Bader Ginsburg was diagnosed in 2009, and surgeons removed her pancreas and spleen, but she passed away in September of last year. Alec Rickman died in 2015, 5 months after being diagnosed. So it is really quick in some cases where they've just been diagnosed and then unfortunately, they've passed away. Astronaut Sally Ride, Patrick Swayze, Michael Landon, all died within months after being diagnosed with pancreatic cancer.
And as you can see, some of them are older adults and some of them are quite young, and they don't last very much. The surgery, when you can have surgery, has its own issues. The Whipple procedure is a pancreaduodenectomy, which can involve removal of your pancreas, a duodenum, even your spleen and part of your stomach. So, it can be difficult to live through it, because if your duodenum is removed and your part of your pancreas or all your pancreas, a common bile duct, and then you have these abnormal connections that you need to be reconnected, you have really a hard time getting back to never want to be normal, but a state that you can live with.
Is the pancreatic cancer, is it more like a nodule, or is it in the blood, or?
No, the pancreatic cancer usually is in the head of the pancreas, not the tail, although you can see it in the tail, and it's a mass. It's actually like a knot, like a golf ball. The treatment with preoperative chemo or preoperative chemo and radiation involves getting the patient in for the treatments. The radiation is targeted. It can be a hypofractionated course, meaning a 5-fraction course. For some people, that's possible. For some other people, it's a standard fractionation. You target the area by fusing your radiographs and then honing in on what you need to treat. And the whole purpose of it, here again, the whole purpose of it is to get you to surgery.
And that's resectable, correct?
So that you make it resectable, from an unresectable state to a resectable state.
Got it. I'm Leanne Powers with Dr. Perez-Tamayo from Central Care Cancer Center, and we've been talking about stomach and pancreatic cancers, but now let's get into esophageal cancer, and you have written a lot about this topic, haven't you, Doctor?
I have written. I was a co-author in the first book of the 12-volume Shackelford surgical text with Dr. Oringer, and then I was a principal investigator for the national protocols in this country that basically determined that, yes, indeed, we need to treat esophageal cancer with a preoperative approach followed by surgery. It turns out that by doing that, you improve survival, you almost triple it, so you need to do it that way. And also I have other articles and presentations, so it is something very near to my heart. I see it more often for reasons that I don't know. And here in Kansas, I believe it's more due to maybe organic solvents that have been used here for many years.
Is that right? Is it because isn't one of the major components or symptoms is having GERD or the gastric reflux? Or?
For the national average, that is one of the symptoms and one of the reasons. Reflux can cause you to have the normal gut in the esophagus, the normal esophageal lining, turn into abnormal, atypical cells that then can turn into cancer. Some people have something called Barrett's esophagitis, which is those changes, and there are some family tendencies to have Barrett's esophagitis. In fact, it's considered a premalignant condition. So if you have Barrett's esophagitis, it cannot be taken lightly. You do have to do something very vital, in fact, even removing your esophagus if you have it, to prevent esophageal cancer, because it is a killer. There's actually, the outcomes, the survival outcomes, depending on stage, can be local for local disease is like 42%, for local regional disease 23%, and for a little bit more is only 4%. So you really need to avoid getting to the higher stages, and if you can avoid it altogether.
Are there different types of esophageal cancer?
Yes, the esophagus is composed of 3 segments. The one is near the post-cricoid area, which is right where your vocal cords are, is the beginning of the esophagus. It's in their neck. And that type of cancer usually is a squamous cell carcinoma, and it can be this type of cell, squamous, such as squash cells, is what you can see also in your oral mucosa, which you can have a head and neck cancer. It can be that up to about the level of the mid esophagus or even distal esophagus. Then the distal esophagus is more of an adenocarcinoma, more like your stomach. And this is what we see more common here in Kansas, and it could be due to Barrett's esophagitis. It could be to reflux. It could also be to exposure to solvents that are like, for instance, DDT or other organic solvents of contamination that can give you this higher incidence. And we're seeing really for the first time much more prevalence on younger patients, and I'm talking in their 20s, with HPV positivity.
How's that?
Well, unfortunately, human papillomavirus is a virus. You don't have barriers. You can't really contain it. It's not in a package. So when you are contaminated with a virus, of course, if it's in your mouth, it will go down your saliva into your esophagus. If it's in your genitals, it can go up into your bladder. So the human papillomavirus will attack any lining. So the lining of your mouth and the lining of your esophagus are about the same. So they actually go into the basal layer and then start making, overproduction of the cells, and then causing you to have atypical cells, which will cause cancer.
So once again, the importance of the HPV vaccination.
Absolutely.
Even at a later age versus the early age, or
yes, they've extended it up to in the 40s. So you certainly are still, possibly qualify for being HPV vaccinated. It could be men and women. Of course, you increase your risk of the squamous type of cancers if you smoke or you consume alcohol. And then, of course, obesity, hiatal hernia, and anything that's going to give you GERD or reflux is going to cause you to have more of the adenocarcinoma, which is the lower part of your esophagus. They're treated similarly. The results are different, and the side effects can be different. The treatment can be very significant because, of course, everything happens in your throat and down when you swallow, even your saliva. So if you have a mass that is obstructing the saliva, it's very difficult for you to handle any liquid, including your own saliva. And in addition, the esophagus, just like when you have reflux, can be painful. The esophageal cancers can give you pain. And what I find most difficult to handle, I think many people with esophageal cancer get severe depression. And it's because no matter what time of day or night, they can't forget their cancer. It's something that swallowing will cause them to always, think, okay, I have this cancer. And then the whole presentation of how this is treated and how the results are not anything to write home about, well, we have issues.
What about esophageal cancer cells spreading? I mean, could it spread then down into the stomach? I mean, or in the lymph nodes? Does it spread that way?
Yes, actually, there's many studies. As I said, just like the stomach, cancer of the esophagus is more prevalent in the Asian countries. And they've done many surgical series where they've removed cancers of the esophagus and they see their spread. And even with stage 1 cancer, 80% of the cancers will already have lymph nodes, even with very small tumors. And why is that? Is that the esophageal cancer has lots of lymphatics and they don't have a covering. So what happens that the cancer can go up and down through the lymphatic system with great propensity. So even when getting it early, you can still have actually quite a bit of involvement, and it only takes one lymph node to take you to a stage 2 or stage 3. In addition, it likes to go to the liver because, again, the blood supply that feeds your esophagus goes to the liver, the lung, and it can go into your bone. The number one presenting symptom is progressive dysphagia, or progressive inability to swallow, and weight loss. Now, the weight loss usually is out of proportion to what you're eating. I mean, the dysphagia or inability to swallow can be even liquids, but it can also be mild. And then, of course, worsening of heartburn. I cannot really highlight enough how, if you're not getting satisfactory treatments with your heartburn medication, you need to have endoscopy done, because sometimes the beginnings of this cancer can be picked up just by the sheer look into your esophagus. And many times you're due for a colonoscopy anyways. They can do it at the same time. It doesn't hurt, and it's very simple. They just take a little sample of it, and then you can tell whether you have some already changes that require some treatment, or you even may have the cancer that is very small.
Because all the Tums, all the Prilosec in the world, sometimes one may not be the best thing for you. I mean,
well, they can mask symptoms. You know, this is one of those things. That's why pain medications sometimes taken make the pain away, but the pain is telling you something. It's telling you that something is not right. So yes, it may actually delay the diagnosis. Sometimes these measures. So when you have persistent heartburn, you need to have endoscopy done just to make sure that it's just a plain reflux. Now, if you have reflux because you have a hiatal hernia, it means that this constant bathing of your esophagus by the acid in your stomach is not good. So that in itself, even if you don't have cancer, needs to be taken care of, because constantly irritating your esophagus by an acid that does not belong there is a problem. So we need to do something. It may be surgical. We call it a plication. Maybe you need to have the esophagus kind of sewn into your diaphragm, or let it come down your thorax. And it actually happens in many animals. In fact, the large breed dogs, this is a common problem. They have the way they are structured, there's often problems with digestion because the stomach tends to want to go into the thorax. So I always feel that, especially large people, tall people, sometimes, and especially if you're overweight, you have a tendency to get a hernia there. Women with the estrogens get a tendency to have a more dilated esophageal, where the esophagus enters your body in your diaphragm is much more relaxed, and you get a hernia. So that may need to be fixed.
So can esophageal cancer necessarily be found early? I mean, as far as prevention goes, I mean, if you
Absolutely. And there's family tendencies. Again, if you have someone in the family with Barrett's esophagitis, you need to let your doctor know, and they need to have you look at a specialist.
And those treatment options, I mean, I've heard of the resection surgery type thing where you would take out, especially if your cancer is at the lower end of your esophagus towards your stomach.
Yes, most of them require preoperative radiation chemotherapy.
Sure.
And we did a big study in the country where we put people into this protocol, and we saw that indeed, if you do preoperative treatment, you have doubling of survival if you do it that way. So here you go, you do a preoperative chemoradiation, and then the patient goes through surgery. And the surgery, depending on where the location of the cancer is, can have just something that is very localized or something that is rather massive. They can even have the esophagus actually delivered through your neck, like you would be pulling a ribbon out of your neck, which is very nice, because if you have something that does not require you to have an open thorax, it is much lighter on you. So this transhiatal esophagectomy is something that some people are candidates for. Some people no. Some people need to have their thorax actually cracked open like you would do a heart surgery, and then some people can have it in the abdomen. Some people just the neck. So it depends on where this is, as the surgery is proportional to that.
Now, you mentioned earlier that you've seen several esophageal cancer cases here in Kansas, and you think that it's probably pretty high here within the state?
I'm astounded at the amount of cancers, especially in western Kansas, and I think that some of the groundwater is contaminated, and these, organic solvents that have been there, some of these you can't get rid of. Their half-life is thousands of years. So for them to even dissolve a little bit is almost, impossible. So, you do need to make sure that your water, your well water, is drinkable. You shouldn't take it as a gospel truth that just because it's a well, it's okay. It may not be okay. So your water needs to be, in the purest form, free of any contamination.
Anything else you want to add about upper GI here cancers?
Well, all of them are silent killers. All of them come in late because they spread early, and they also you can have a cancer that is sizable before it starts giving you trouble. So again, be your own advocate. If you feel that something isn't right, it probably isn't. So you must dig a little further. Come and see us if you want advice as to what's the next step. We'll be happy to see you.
Be aware, definitely, of those symptoms if you're experiencing any of them. Thank you, Dr. Perez-Tamayo. Thank you so much, Dr. Perez-Tamayo. Well, we appreciate you taking the time to listen to Cancer Explained with Central Care Cancer Center. With facilities throughout rural Kansas and in Missouri, Central Care offers complete cancer care, all under one roof, so there's no need to travel far for the best care. Whether you need radiation or chemotherapy, maybe just a second opinion, access to clinical trials and novel treatments, financial counseling, or other supportive services for yourself or your family, Central Care is here for you. You have a choice. Bringing expert care to you is an important component in the success of your outcome. Being surrounded by your family and friends, that can be the factor that elevates your treatment. Feel free to reach out by calling 800-592-5110 or visit us online at cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening to Cancer Explained with Central Care Cancer Center.
You've been listening to Cancer Explained with Central Care Cancer Center, offering expert cancer care that's close to home. Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center, online, cccancer.com.